Welcome back. In today's video, we are going to discuss about otitis media as a continuation of our ENT series. Otitis media refers to the inflammation of the middle ear cleft. Otitis media is not only the most common bacterial infection in the children, but also a leading cause of hearing loss in the children. So guys, what is otitis media? It is the inflammation of the middle ear cleft. This otitis media is a bacterial infection. There is invasion of the bacteria. There is bacterial infection and a leading cause of hearing loss, deafness in the children. This is the normal middle ear and this is the otitis media, that is infection of the middle ear cleft by microorganisms, that is bacteria. The two major classes of otitis media are acute otitis media and chronic otitis media. In this video, we'll be specifically dealing with acute otitis media. Before understanding acute otitis media, we need to know the normal anatomy of the ear. The ear is an organ which is used for hearing and for the balance. The parts of the ear will be divided into three, that is an outer ear, middle ear and the inner ear. Starting with the external or outer ear, it will contain the helix, tragus and the lobule, which is nothing but the outer ear, that is pinna. External auditory canal or tube. So we saw with the continuation of the helix, the tragus, the small folding in the lobule, it continues as the external auditory canal. This external auditory canal, it is connecting the outer ear to the middle ear. Now in the middle ear, there is tympanic membrane. The tympanic membrane will divide the external ear from the middle ear. It's just a part like a divider there, okay? It is dividing the external ear from the middle ear. This tympanic cavity will consist of the three auditory ossicles, which we know, that is incus, malleus and stapes. Then continuation of this, we have the eustachian tube. This eustachian tube is a canal which will link the middle ear with the back of the nose. Okay, this eustachian tube, it will continue and then end up in the back of the nose, that is nasopharynx. Now we come to the inner ear. The inner ear will consist of the cochlea, this snail kind of character, the cochlea, which will contain the nerves for hearing. Then we also have the vestibulocochlear nerve. Then the vestibular apparatus comprises of the semicircular canals in the vestibule, which will contain the receptors for balance. Hope the anatomy is clear. More specifically, we'll be dealing with the middle ear. Acute otitis media, there is a bulging tympanic membrane. This is the normal tympanic membrane. Okay, because of the acute inflammation, there is bulging tympanic membrane. Acute otitis media is an acute pyogenic inflammation of the middle ear. So pyogenic is this in the sense it is a bacterial infection. There is also pus formation. It is a pyogenic inflammation of the middle ear cleft. It will include the external ear, middle ear, attic, adytus, antrum and maston air cells. Here they are talking about attic, adytus, antrum and the mastoid air cells. So let us see the anatomy of the middle ear. The mastoid antrum, what you are seeing here, this antrum is an air space which is communicating posteriorly with the mastoid air cells. So this antrum is communicating posteriorly with the mastoid air cells. And then we have a slight constriction which is dividing it into upper and lower chamber, that is the adytus attic. Okay. Then we have the eustachian tube which is connecting to the nasopharynx. So we know attic, adytus, antrum, mastoid, air cells. This is what they are talking about. Acute otitis media is a pyogenic inflammation of the middle ear cleft. It is including the external ear. In the middle ear there is attic, adytus, antrum, mastodon air cells or the mastoid air cells. So this is clear. Now let us look at the causative organism. Which is this organism which is causing the acute otitis media in the ear? The most common organisms are Streptococcus pneumoniae, Haemophilus influenza, Branhamella cataralis, also known as Moraxella cataralis. So these organisms, pyogenic organisms you have to memorize. Streptococcus pneumonia is the most common ones. Along with them, what we read now. Other common are Streptococcus pyogenes, Staphylococcus aureus. Uncommon are the gram-negative bacilli from the skin, which is after trauma, such as Bacillus proteus, Bacillus pyoceneus, Bacillus coli. In some cases, no organisms are found. Okay guys, so from this you have to remember Streptococcus pneumonia, Streptococcus pyogenes, Staphylococcus aureus, Haemophilus influenza. In the gram-negative, we have Bacillus proteus, Bacillus pyoceneus, and Bacillus coli. Bacillus, Bacillus, Bacillus. You have to remember proteus, pyoceneus, and coli. Okay. Next, what do we have? The etiology, the root of infection. How does the microorganisms, the microorganisms which we listed above, these microorganisms, how do they reach the ear? What is their route? It is through the eustachian tube. The infection in the middle ear is usually reaching through the eustachian tube. The reflex from the nasopharynx into the middle ear. So guys, you can see in the picture here, I told you this eustachian tube is connecting to the posterior part of the nose. So this is the nasopharynx, and because of the nasal reflux from the nasopharynx into the middle ear will occur during the swallowing and during nose blowing and close the nose swallowing. So when people close their nose and swallow things, what happens? This reflux will be there, which is causing the microorganisms to enter from the nasopharynx into the middle ear. It is a result of negative middle ear pressure. Okay, that is which is done during the sniffing. Negative middle ear pressure will be created. So we know the nasopharynx, and from the eustachian tube, the infection is traveling and entering into the middle ear. Anatomical obstruction, the big adenoids and nasopharyngeal tumors. So from this thing we can see the adenoid tissue. This adenoid tissue is a reservoir of microorganisms. All the microorganisms will be stored there. And from this can also lead to can enter into the eustachian tube, cause the otitis media. Infection, adenoiditis, tonsillitis, rhinitis, sinusitis, pharyngitis. So all the inflammatory conditions, inflammation of adenoids, inflammation of tonsils, that is rhinitis is the inflammation of the mucous membrane of the nose, sinusitis, inflammation of mucous membranes of the sinuses, and pharyngitis, inflammation of pharynx. And as I told you, the adenoids will serve as the bacterial reservoir in the nasopharynx in the children with acute otitis media. So in the children, this adenoid tissue will serve as a reservoir. And also all the inflammatory conditions surrounding to the ear, the adenoids, tonsils, nose, sinuses and pharynx, all this tissue, whenever there is inflammatory conditions in these particular parts, the microorganisms can migrate and then enter the middle ear, leading to otitis media. Iatrogenic cause, post-nasal packing. We'll be dealing with the postnatal packing in the further slides in the treatment part. And after adenoidectomy, that is removal of adenoids. So there is no reservoir of the microorganisms, it is directly entering into the eustachian tube. Feeding bottle. In the supine position, the bottle feeding may lead the milk to enter into the middle ear. So in the supine position, when the baby is lying and drinking the bottle, the bottle feeding is done, drinking the milk, what happens? The milk will enter the middle ear via the eustachian tube. The pre-existing tympanic membrane perforation. The trauma while cleaning the external auditory canal, an open hand slap on the ear, and past chronic suppurative otitis media. So if a person is cleaning his ear using something and then somebody gives a slap on his ear and the thing can go into the ear, leading to a trauma, and tympanic membrane perforation can occur. And also there is past chronic suppurative otitis media can also result in a increase of acute otitis media. Past he had chronic one, then it's healed, again the acute attack has happened. Fracture of the temporal bone can also cause otitis media. Blood-borne infections are the rare cases. Forceful blowing of the nose. The forcible blowing of the nose can push the infection into the middle ear through the eustachian tube. So we saw in the picture there was nasopharynx and then eustachian tube which is connecting to the middle ear. Whenever there is forceful blowing, the microorganisms, the infection will go into the nasopharynx. From the nasopharynx, eustachian tube, ultimately reaching the middle ear cleft. Swimming, especially during the diving, the water will enter in the nose under the pressure. If the water is infected, what can happen? It can spread the infection to the nose, to the sinus and to the middle ear. Okay, only if the water is infected, the acute otitis media can occur. The predisposing factors for acute otitis media are reduced immunity. So the people who are prone to get acute otitis media, any one of the factor will be present in a person suffering with, one or more can be present in a person suffering with AOM. Reduced immunity, barotrauma, exanthematous fevers, palatal disorders, nasal allergy. Okay, the palatal disorders, nasal allergy. Stages. The course of the disease is divided into 5 stages: tubal occlusion, pre-suppuration, suppuration and ends with either resolution or complication. So we have tubal occlusion, pre-suppuration, then comes suppuration. This suppurative stage can either end in resolution or complication. Each of these stages will be discussed in detail. Tubal occlusion, the edema, that is swelling, and hyperemia of the nasopharynx and eustachian tube, which leads to the absorption of air and creation of negative middle ear pressure. So guys, here they are saying there is edema and hyperemia of the nasopharynx and eustachian tube. So this nasopharynx, eustachian tube, there is swelling and also increased blood supply, hyperemia. Okay, so what's happening? Because of that, it is leading to the absorption of air and a negative middle ear pressure has been created, leading to infection. Symptoms: there will be mild deafness, ear fullness, ear pain, but the patient doesn't have fever. Since the inflammatory process didn't start yet, there is no fever. There is just mild deafness, fullness and ear pain. What are the signs? Retracted tympanic membrane. What are the findings? They will include the relative shortening and more horizontal position of malleus handle, prominent lateral processes of malleus and the loss of light reflex. So guys, you see there is shortening and horizontal positioning of the malleus handle. So we need to know the parts of the middle ear. This is the handle of malleus, this pars tensa and cone of light, and pars flaccida. More will be focusing on the handle of malleus. So the handle of malleus, what's happening? There is shortening. There is a shortening of the handle of malleus and also the more horizontal positioning. Okay, this is being placed horizontally. Horizontal positioning of the malleolus. Okay, and then there is also the prominent lateral processes of malleus and the light reflex is lost. There is also conductive hearing loss. This is in the tubal occlusion. There is edema, hyperemia, negative ear pressure. There is no fever, deafness, ear pain will be there, ear fullness. Then in the signs we have a shortening and horizontal positioning of the malleus handle, and then light reflex is lost, hearing loss. There is also conductive hearing loss. Stage of pre-suppuration. The prolonged tubal occlusion. So we saw if there is tubal occlusion for a prolonged period, it can facilitate the invasion of the pyogenic organisms into the middle ear. So whenever the tubal occlusion is for a long period, that is nasopharynx, eustachian tube were affected so far. Now the tubal occlusion is for a long period. Now the microorganisms, the infection is spreading further into the middle ear and it will result in mucosal hyperemia. inflammatory exudate will appear in the middle ear. So guys, you can see the inflammatory exudate here, which is appearing in the middle ear. This inflammatory exudate. Okay, this is in pre-suppuration. Now we move on. Oh, what's wrong with this? Okay. Marked. So what are the symptoms if a patient comes in when he is in the stage of pre-suppuration? It is not completely gone into a suppurative stage, it is in the pre-suppuration. In the pre-suppurative stage, the patient will come with a throbbing ear pain, which is awakening the child from sleep in the night. Okay, there is a severe throbbing ear pain, high degree of fever and restlessness. There is fever and bubbling sound in the ear. Deafness, though present, does not get the child's attention because of the severe ear pain. There will be deafness present, but the ear pain is so severe that it is not drawing anybody's attention. There is ear pain, throbbing ear pain, high fever, restlessness, then there is bubbling sound and deafness. Now we move into the signs. Pars tensa is congested and bulging out with a cartwheel appearance. So guys, here they are talking about the cartwheel appearance, which is given in the picture here. You see this cartwheel appearance. Okay, it's like a cart of a wheel. You getting it? So in which stage we have this? The signs of pre-suppurative stage. You have to write about this cartwheel appearance. There is leash of blood vessels along the handle of malleus and at the periphery of tympanic membrane. What we saw right now was like this is the handle of the malleus. This cartwheel appearance is around the handle of the malleus. This is the handle of malleus. Okay, handle. So now this is the handle of the malleus and at the periphery of tympanic membrane. There is loss of light reflex. Later on, the complete tympanic membrane, including the pars flaccida, will be congested and red. The tuning fork test will show conductive hearing loss. So guys, there is cartwheel appearance around the malleus of handle and then handle of malleus. Second thing, they are talking about pars flaccida. In the pars flaccida, it is congested and it has become red. This is the signs of pre-suppurative stage. Now we move on to the next stage, stage of suppuration. There occurs the formation of pus. Suppuration is nothing but the formation of pus in the middle ear and somewhat in the mastoid air cells. So we know that there is antrum and connected to the antrum there is a air space in which the mastoid air cells will be present. So there is formation of pus in the middle ear and in the mastoid air cells. The tympanic membrane will start bulging. Okay. Next, we move on to the symptoms. So when a person is in the stage of suppuration, there will be excruciating ear pain, increasing deafness, rising fever, which is accomplished with vomiting, diarrhea, and even convulsions. So we have ear pain, which is excruciating type. And there is deafness is increasing. As the stages are progressing, the deafness is increasing. Now we move to the signs. In the signs, the tympanic membrane will appear red. Okay, tympanic membrane is red and it is bulging to the point of rupture. Okay guys, it's gone to a very late stage. The tympanic membrane has come to a stage of rupture and there is loss of landmarks. You cannot actually point the marks of the tympanic membrane. You cannot locate the tympanic membrane. It is losing the landmarks. Handle of malleus is engulfed by the swollen and protruding tympanic membrane. So this handle of malleus, it is being engulfed by the protruding tympanic membrane. This tympanic membrane is protruding it and it is losing the handle of malleus. Is only it's been like engulfed. It is being engulfed by the protruding tympanic membrane. A yellow spot on the tympanic membrane. I'll show you the picture. You will be able to appreciate it well. So okay, see guys, this thing, we also have a yellow spot on it and then in the stage of suppuration, what's happening? A yellow spot on the tympanic membrane where the rupture is imminent. So first this yellow spot comes. Once the yellow spot comes, then there the rupture is going to occur. Okay, then What is this yellow spot? It is like a nipple-like protrusion of the tympanic membrane with a yellow spot on its summit. Tenderness over the mastoid antrum in the region of the suprameatal triangle due to the mastoidism. The clouding of the air cells in the X-ray of the mastoid because of the exudates. So guys, here they're talking about the tenderness of the mastoid antrum. So we know where the mastoid antrum is. There is tenderness in that area and in the region of the suprameatal triangle. This suprameatal triangle, you see in the patient, there will be tenderness in the suprameatal triangle because of the antrum being present there, the ear region, right? So the ears, the antrum is there, and the suprameatal triangle, there is tenderness. It is because of mastoidism. And then in the X-ray, there will be a clouding of the air cells. It is because of the exudates being present in the air cells. Since suppuration has happened, there is exudation, and then because of the exudate, what's happening in the X-ray, you can see the clouding of the air cells. We know there is antrum, and then posteriorly there will be mastoid air cells. Hope it is clear. We saw the signs of suppuration. Symptoms are very easy. Now you have to only focus on the signs. In the signs you have to write tympanic membrane is red. Then the tympanic membrane has become red and there is going to be rupture. So it is losing the landmarks. Then we come to the handle of malleus. It is being engulfed by tympanic membrane. Then we saw a yellow spot which is going to rupture. Then also there is tenderness on the mastoid antrum, which is in the suprameatal triangle. We saw where the suprameatal triangle is. Then in the X-ray, because of the clouding of the air cells, the X-ray of the mastoid will become, there will be clouding, okay. Then stage of resolution. In stage of resolution, the tympanic membrane ruptures and results in otorrhea and subsidence of other symptoms. So guys, the tympanic membrane is finally rupturing in the stage of resolution. Then there occurs otorrhea and the other symptoms are going to subside. The otorrhea, there will be blood-tinged ear discharge. With the ear discharge is serosanguinous, and the serosanguinous discharge is later becoming mucopurulent discharge. Then the external auditory canal filled with blood-tinged or mucopurulent discharge. We saw the symptoms, okay, there is blood-tinged ear discharge. So even the external auditory canal, the external ear, from the middle ear, it is coming out now. The external auditory canal will have a blood-tinged or a mucopurulent discharge which is pulsatile. This is the lighthouse sign. The pus which is coming out under pressure and it is synchronizing with the each arterial dilatation of the heartbeat. Every heartbeat, the pus is also dilating and coming out. So this is known as lighthouse sign. They're talking about this. There is the mucopurulent discharge, the blood-tinged or the mucopurulent discharge which is coming out of the external auditory canal. It is synchronizing with the arterial heartbeat. Perforation of the pars tensa usually in the antero-inferior quadrant. So guys, if this is so we saw this is the handle of malleus pars tensa in the antero-inferior, okay. If you divide it into 4 parts, this is antero-superior, antero-inferior. This will be posterior-superior, posterior-inferior. So in the antero-inferior, this part, okay. So in this part, we divided into 4. In the antero-inferior part, there will be perforation, okay. That is, a hole will be formed. A hole is going to be formed in the antero-inferior quadrant. In the stage of complication, what happens? This acute otitis media can result into acute mastoiditis, labyrinthitis, meningitis, brain abscess and extradural abscess. Then starting with acute mastoiditis, it is a bacterial infection, okay. It is the bacterial infection which is affecting the mastoid bone as a consequence of the acute otitis media. Then we have labyrinthitis, which is the irritation and swelling of the inner ear. The labyrinth, inner ear, there is irritation and swelling. Then the other complication, we have meningitis, inflammation of the meningeal layer of the brain. Then extradural abscess, Extradural abscess is nothing but the collection of the suppurative material in the intracranial epidural space. So you can see the epidural space. When there is a collection of the suppurative material, it is extradural abscess. Now, how do you diagnose the acute otitis media? Acute otitis media is the clinical diagnosis. The test for the hearing should be done. They will show the conductive hearing loss. CT, temporal bone, CT scan of the temporal bone. It is indicated only in the cases of refractory mastoiditis. The clouding of the air cells because of the exudate, we saw already in the stage of resolution. There will be clouding of the air cells because of the exudates, and the pressure necrosis, which is coalescent mastoiditis. Then these can be seen. The clouding of air cells and the pressure necrosis can be seen. Demineralization of the air cell septa is the key radiographic sign of the mastoid otitis. Okay. So whenever there is mastoid osteitis, there is demineralization of the air cell septa. So guys, in the diagnosis, you have to remember that you have to perform the test for the hearing. There will be conductive hearing loss. In the CT scan, you can see the refractory mastoiditis. Then the clouding of the air cells because of exudates and pressure necrosis. Bacteriological examination. The ear discharge is submitted for culture and the sensitivity to know the type of causative organism. So we send the discharge. We take a discharge from the ear and send it for the examination. You can figure out the causative microorganisms which we listed before, and also the antibiotic which can be sensitive to that microorganism can also be made out. Okay. Differential diagnosis. There is otalgia, which is nothing but ear pain. Otorrhea. Otorrhea means there is drainage of the liquid from the ear. And then otitis externa. And then they're talking about laryngitis and bilious meningitis. So bilious meningitis itself is the inflammatory condition of tympanic membrane. Bilious meningitis is the infection which is characterized by a bullae or a vesicle on the tympanic membrane. So let us revise. What is otalgia? It is pain. Then otorrhea, you can the differential diagnosis for AOM, acute otitis media. You can differentiate it with otalgia, which is pain. Otorrhea is the drainage of liquid or a pus. Then drainage of liquid, which could be pus. And then we have otitis externa, meningitis and bilious meningitis. Meningitis is what, guys? Infectious condition of the tympanic membrane. And then on the tympanic membrane, if the vesicles are formed, it is this thing. Okay. Now we move